Hello, I'm Peter Holden, the president of Jordan Hospital. It's a privilege to be here and a privilege to work with such wonderful people so dedicated to the care and well-being of their patients and the community we serve. You're about to hear from some of those people as they explain our core values and how they try and make them real every day. I'd ask you to listen closely because these values underscore everything we do, everything we say, all the time. These values don't just drive how we treat our patients and our families. They guide how we treat one another as colleagues every day as well. Patients and families come to us at some of the most stressful and difficult times in their lives. And if we help one another, we'll do an even better job helping them. And that, after all, is why we're all here.
It doesn't matter what you do here. You're important.
You need to be able to look at yourself and say, what is it that I'm bringing to the situation?
Sometimes our actions and our behaviors don't translate into giving that patient above average care.
I think it's becoming more cognizant of the values, being more aware.
Where we start, where we're going, and how it's going to work.
I think what we're trying to create by defining these values is an enhanced sense of who we are.
Our definition of integrity is to act and speak with honesty and to own our individual actions and behaviors, how the values team defined integrity. Well, I think we're healthcare providers, so it's important that we remember why we're doing what we're doing and how we treat each other and treat our patients. I'm a speech pathologist, so I was called to the ICU to do a swallow evaluation on a gentleman who was withdrawing from alcohol. Hi, I'm Charlotte from speech therapy, and I'm here to do a swallowing evaluation on this gentleman.
Good luck with that. He's a whole drunk.
I didn't feel it represented who she was as a person, but I felt it was an inappropriate response that needed addressing. You know, I could probably ask him and he could probably tell me 10 other places he would rather be than lying in a hospital bed withdrawing from alcohol and having somebody else change his diapers. We're here to take care of our patients and not judge the reason that brought them to us. And she said,
Yeah, you're absolutely right. Thank you for stopping me. You're right. I need a vacation day. Have a good day.
Thanks, you too. Hi. We're not perfect. There's absolutely no way that we can be perfect. But there's nothing wrong with owning your behavior, learn from it, and hope that you don't do it again. But we also need to be able to call each other out if we need to. You know, we got to check each other. That's what we need to do.
My notion of it was that everything we do here at the hospital needs to bounce off these values. If it doesn't fit into these values, then we don't do it. I think the ultimate goal is, at least for me, was just be nicer to each other, be more respectful, just to be kind, you know, and respect, it's like you need to earn respect.
Jordan Hospital Lab, Linda speaking.
Hey Linda, this is Dr. Galis. Do you have my results?
Can I have the patient's name, please?
Patient's name is Dobek. Do you guys know what you're doing?
Yes, we do. Let me look it up in the computer and see what's the delay.
Well, what does that mean? How long am I going to have to wait?
It shouldn't be much longer. Let me see. There it is. It is still in process. As soon as we get the results completed, I could easily page you.
All right, I got to go. Just page me.
Okay, thank you.
I could blame this person for being rude to me and, you know, not being respectful, but if I don't work on shifting that, if I don't see where I can be different, that relationship's not going to change.
Jordan Hospital Lab, Linda speaking.
Hey Linda, this is Dr. Gillis. You paged me?
Yes, I got the results on the patient, Dobek. It was 7.1.
Okay, great, thank you. And sorry that I was a little bit short on the phone earlier.
No problem. You have a good day.
Same to you. Bye.
We can't change other people, but when we change, when we're different in how we interact with people, you know, they may stomp their feet and say, change back, but if you continue to model that behavior, people are going to come around. They're going to come around to say, oh, okay, I can't talk to her that way. Or, no, I need to do this differently. But it is about practice. Just like anything you want to do well in life, you have to practice. And these values, you have to practice them. You have to be mindful of them every day.
The type of work that we do, we really need to know each other, to rely on each other, to trust each other. If you can trust the people that you're working with, and you know that they are prepared, that they have the best interest of the patient at heart, that they trust you, it's a win-win. Patients are smart, and they watch us, and they listen, and they know what's going on around them. And I think it's really important with patients that they feel confident. And they will pick up on our confidence, and I think the better we are at what we do, the better we trust and take care of each other as employees. The patients know that, and it makes them feel more secure and hopefully creates a better healing environment.
Excuse me, my son was brought in by ambulance, Spencer Malone.
Yes.
Is he okay?
Yeah, Mrs. Malone, right this way.
Okay.
He fell at the playground. The doctor.
Did he break anything?
I'm not sure. The doctor's been in to see him. We've been waiting for you.
Does he know I'm coming?
I believe he does. He's anxiously awaiting you.
Baby!
In that circumstance, I trust that the people that are taking care of that patient in the trauma room or wherever are doing the very best job that they can. They know what they're doing. They're prepared, they're compassionate, they want the best outcome for that patient. And I can trust that. I think it has to be real. I don't think you can just put words out there and say, okay, these are our core values. I think you have to live them. And I think the more people live them and model them for each other, the more they'll become part of the fabric or the culture of the hospital.
The way I do that for myself is when I put on my badge every day, that's a reminder to me of the values and what I want this hospital to stand for and what kind of place I want to work in and what kind of environment I want for my patients. You're right, I mean, they're simple values. It's the golden rule that everybody knows how we should act, and what we do sometimes counteracts that. But, I mean, those are the times that you have to rely on each other and have the teamwork and, you know, rely on your coworkers for a second check.
Whitney, can you get that, please?
Cardiovascular. Yep, okay, I have a few other things to do.
Whitney.
Hold on for 1 minute, please.
I need this taken care of right away.
Okay, all right, thank you. Yep, okay. Okay, yep, I have a few other things to do, and, okay, 5 minutes, yep, I'll get back to you in 5 minutes then. Okay, thank you. All right, bye-bye.
Let me do that for
Are
you.
you sure?
Yeah,
Are you sure?
Yeah,
Okay,
I can
all right,
time.
thank you so much.
problem.
I appreciate it.
No problem.
Thank you.
Nobody's perfect, and I catch myself not adhering to the values all the time, and I have to remind myself, you know, but I catch myself now, because once we keep learning and hearing about these values and trying to follow them, that's what you're going to change about yourself. You can't change anybody else. You can only change the way you act and the way you react to other people. So if you keep doing that, then the values will come forward.
Vicki, do you have a minute?
Yeah.
I just wanted to thank you so much for helping me out earlier when I had all that stuff going on. I just felt really overwhelmed, and just wanted to say thanks for stepping in and taking some of the burden off of me. I really appreciate all the help.
You're welcome. I'm glad I could help.
Oh, well, thank you so much.
Anytime.
I appreciate it.
Anytime.
Thanks.
I think it's going to shift our whole culture, that if, you know, all those values, the integrity, trust, teamwork, respect, and excellence, if we bring those into our everyday practice and are just more mindful of them, that the whole culture is going to start changing. And it's not going to become something you think of, it's just part of who we are and what we are, you know, displaying and what we want our culture to be at Jordan Hospital.
And I don't think we give each other enough credit because we do it every day. So when something positive does happen, at that moment, either to thank them or encourage them or say, you know, what a great job you've done. And I believe that my core value that I'm presenting today is excellence. I believe that so many people have excellence moments throughout the day and throughout the week that they blend into a normal, they believe that they're normal, but they are. They really touch people's lives and their family and all of our patients that come here.
Hi Marina, how you doing? We're just about ready to go in. How you feeling? Good. You doing okay? Mom's gonna come in with us. All right, we're gonna take a ride.
Walk in with you.
Okay, no need to be nervous. We're gonna give you a little bit of sedation to get you nice and relaxed before we head in, okay?
Okay. This will be all over very quickly. Mom's gonna stay with you till you go off to sleep, and then you'll see her as soon as you're waking up in the recovery room.
I'll be there for you when you wake up, okay?
Let's roll. Mom's gonna come with us.
First off, as healthcare workers, I believe that we're so touched by people's lives and blessed to be involved in so many people's lives. I work in the operating room, and children have surgeries almost every day there. What we do for children and the parents, we allow the one parent to bring the child into the operating room and stay with them until they go to sleep. We take the child from the parent and then let them give them a kiss, and we walk the parent back out into the waiting room. When we're walking the parent back to the waiting room, they're usually in tears and very upset. This is like one of the toughest things that they have to do in their whole life. And we assure them that we will give their child excellent care. It's very little steps, but it will work. And once it really gets into people's heads to think about what they're doing, when you come in the morning, it's a good day. You know, you leave all your negativity at the door, come in, do your work in an excellent way, and go home and be proud of what you've done.
If I'm sitting here trying to define these core values, how do I understand them better myself? And I think in doing so, it changed me. I've always practiced with my patient in the center, in the core, but I think everyone can change and improve no matter what level you are. I think it's just a process of improvement for everyone to embark upon, and I'm not excluded from that. I think Jordan Hospital is a great hospital. I really enjoy being here. I've been here for 7 years. I think, though, it can be a lot better. I think we can be so much better, and if we put our minds to it, living the core values, I think, is we have to begin. You have to begin by coming to work every day with a set purpose of interrelating with your colleagues and promoting the best possible patient care. It takes a long time to change a culture, but I think if we touch each other one by one, and as we roll this out and we give people the support and the guidance that they need, and the examples to look forward to, then I think over time those one-on-ones become more. Our hope is that over time we come up with ways to encourage the majority of the people in this organization to embrace and live these core values, and that over time our organization is taken into the next decade in excellence.